Hi, everybody. Welcome to our lecture about cardiovascular system. This is part two. So we have already talked about the chambers of the heart. We have talked about the main blood vessels of the heart, as well as the valves of the heart. Now just kind of review some of the concepts here using this picture. We can identify our right side of the heart from the left side of the heart. So here is my right atrium. This area would be my right ventricle. This would be my left atrium and left ventricle. Coming into my right atrium, I have superior and inferior vena cava, bringing deoxygenated blood from my systemic circulation. The blood moves from my right atrium down to my right ventricle and pumped through the pulmonary trunk and the two branches of left and right pulmonary artery. This blood is destined for lungs to undergo gas exchange, picking up oxygen and dropping off carbon dioxide. The blood comes back from the lungs through the two pulmonary, or total of 4 pulmonary veins, 2 right pulmonary veins and 2 left pulmonary veins. All 4 of these are emptying into the left atrium. Blood moves from the left atrium down to the left ventricle. And from the left ventricle, it is pumped through the largest blood vessel we have, called the aorta. And aorta, again, I mentioned this last time, but kind of looking at the labeling, you have the ascending aorta because blood is moving up. It moves through the aortic arch and then moves downward to the descending aorta. You have a few other structures that I haven't mentioned, and I do want to spend some time on this right now, is this one, which is ligamentum arteriosum. Ligamentum arteriosum is a actual opening connections between the pulmonary trunk and aorta in fetal circulation. This is basically allows the blood on the right hand side to get directly access to the aorta. Because if you think about it, pulmonary trunk is going to send blood to your lungs. However, the lungs in a fetus are not working. So that basically allows that circulation to basically be bypassed and empty all of its blood into the aorta. Now, as soon as the baby is born and take its first breath, one of the structures that will close is this connection and eventually hardens to form the ligamentum arteriosum. The other structure, the other part that I want to talk about is the 3 blood vessels you see up here. These 3 are your pulmonary, these are your branching off of the aortic arch, and they are supplying the arms, neck, and head. So starting from the beginning of the aortic arch, you have the first branch, which is called the brachiocephalic trunk or brachiocephalic artery. You also have the second branch. This is referred to as the left common carotid artery. This middle branch basically goes up the side of your neck to your head and basically supplying the brain tissue with oxygenated blood. And the third branch, which is the last branch of your aortic arch, is left subclavian artery. This branch goes over the shoulder. Clavian implies the clavicle, goes over the shoulder and basically supplies the left arm. So if you wonder where is the right side or the right supply of blood vessels or right blood vessels, these are branching coming off of the brachiocephalic. So if you continue brachiocephalic goes up the side of neck to form the right common carotid artery. And it also can have a second branch that goes over the right arm, which is your right subclavian artery. Now, moving on, what we have is basically this picture is depicting the circulation of the blood through the right and left side of the heart. or in other sense, the pulmonary and systemic circulation. It is a really good way of you guys reviewing without looking at the labels to see if you guys can follow this on your own. This picture includes the blood vessels, includes the valves, as well as include the chambers of the heart. So let's go ahead and get started. So we have the inferior and superior vena cava releasing their blood, as well as the coronary sinus, releasing their blood into the right atrium. Blood passes from the right atrium through the tricuspid valve into the right ventricle. As it goes, right ventricle pumps the blood through the pulmonary valve, through the pulmonary trunk, eventually through the pulmonary arteries, and send that blood to your lungs. Again, notice that there is a color change happening here. Your blood is going from oxygenated to deoxygenated. That blood gets picked up by your 4 pulmonary veins and enters the left atrium. From the left atrium, it passes through the mitral valve or bicuspid valve and enters the left ventricle. Left ventricle pumps that blood through the aortic valve, out through the aorta, and through the systemic circulation, where you will have the second gas exchange, where your blood goes from oxygenated to deoxygenated. Now, when we're looking at the procedures of the heart, you have an average about 60 to 100 beats per minute, which is considered a normal heart rate. But in average, people have a heartbeat of 70 to 80 beats per minute at resting. This heart is basically, every time your heart beats, it has 2 phases, a contractile first and a relaxation first. The contraction of the heart is referred to as systole, and the relaxation or expansion of the heart is referred to as the diastole. These systole and diastole typically refer to the ventricles as they contract and relax, and basically circulates the blood through your systemic or pulmonary circuits. We also have what we identify as the sounds associated with your valves. So every time your AV valves, as well as your semilunar valves closes, they create a sound. And this is a sound that we typically associate with the lub-dub sound. Lub is associated with the AV valves closing, and dub is associated with your semilunar valves closing. However, if you want to be particular, there are actually 4 sounds associated with these valves, 1 sound for each of the valves, and they can be heard in very specific locations. So, pulmonary valves can be heard on the superior left corner, and aortic valve can be heard on the superior right corner. And here is when my students get a little confused, because we have talked about pulmonary valve in terms of the right ventricle and the pulmonary trunk, and then aortic valve, we have talked about it in terms of left ventricle and the aorta. So how is that I hear the sound in the opposite side? For that, I'm going to show you the picture. So look at the picture. When we look at the pulmonary trunk that starts from the right ventricle actually moves or shifts to the left side of the heart as it moves, basically. Here is your pulmonary trunk, so follow where my cursor is. So it shifts to the left. However, aorta, which starts from the left side, shifts to the right and then circles around. So basically, the valves that associated with aorta are more on the right-hand side, and the valve associated with the pulmonary trunk is associated with the left side of the heart. Now, specifically, aortic valve is heard in the second intercostal space on the right sternal margin. So if the words sound really unfamiliar to you, break it down for yourself. Second intercostal, second implies the second space between your rib cage. So intercostal means the space between your rib cage. Sternal margin, which basically means on the side of your sternum or on the right side of the sternum. It says sounds heard on the second intercostal, so literally go across but now it's on the left sternal margin. So if you imagine a sternum is right in the middle, on the right side of it will be your aortic valve, on the left side would be your pulmonary valve. Now, your AV valves, which are your bicuspid and tricuspid, are held on the right side as they are associated with. So mitral valve is held typically on the apex, which is on the left side of the heart. And then tricuspid is held on the inferior right corner. So let's take a look at the picture. Again, mitral valve sounds heard over the heart apex. Again, here's the peak of the apex. This is the fifth intercostal space, which is right in the middle of the clavicle. So again, if you imagine this, here's your clavicle. Take the midpoint of the clavicle, come down. In the apex, the fifth intercostal, that's your mitral valve. Typically, we say go across from that in the middle of the right sternal margin. That's where you will hear the tricuspid valve. So tricuspid valve is a little bit more inward. The apex of the heart is a little bit more toward the left, so you will hear the middle of the clavicle versus more on the sternal margin as you hear it for the tricuspid. I keep it simple, guys, as far as you understand that the aortic and pulmonary valves are on the opposite and on the second intercostals, versus tricuspid and bicuspid are on the fifth intercostals and on the right side, as in tricuspid on the right and the bicuspid on the left. That will suffice for us. So the next concept I want to talk to you guys about is the electrical impulses that causes heart to contract. Now, our previous lectures focused on the muscular system, and we had an understanding that if I want to contract the muscle, I need electrical impulses from my neurons or my nerve cells or my nervous system. In terms of your heart, we rely on a different system called intrinsic conduction system. Intrinsic conduction system relies on a category of the cells called non-contractile cells. So non-contractile cells. These cells are strategically located throughout the heart and form very specific structures with the goal of creating and spreading the electrical impulse throughout the heart that leads to muscle contraction. So if I'm looking at the main difference between the skeletal muscle and the electrical impulse associated with it and compare it to the cardiac muscle, the main difference is where that electrical impulse originates from. If you're looking at the skeletal muscle, the electrical impulse comes from the nervous system. But if I'm talking about the cardiac muscle, the electrical impulse comes from non-contractile cells that forms what we call intrinsic conduction system. So intrinsic conduction system starts with a cluster of non-contractile cells called cyanoatrial node. This is located on the superior part of the atria. And this is the one that initiates the electrical impulse. Therefore, it's called the pacemaker of the heart. If you ever heard of what we call sinus rhythm, if you look at an ECG and say, oh, the person has a normal sinus rhythm, basically what they means is that the SA node is creating regularly spaced electrical impulses, which leads to muscle contraction, or basically what we identify as heart beating. So typically, SA node generates in average about 75 electrical impulses per minute, which basically leads to, again, 75 heartbeats per minute. Now, these impulses are going to spread from the atria down to the next structure, which is your AV node. AV node is localized between the right atrium and the right ventricle, and again, hence the name AV node. There is a delay in the signal here, about 0.1 second, because the fibers in these regions, the non-contractile fibers, are thinner. and they don't have as much gap junction for transferring the electrical impulses. Now, this delay, this 0.1 second delay is extremely important because it allows my atria to contract first, pushing as much blood down to the ventricles before my ventricles contract. So if the SA node is knocked out, the AV node can take over. However, it is not as strong as your pacemaker. Therefore, the inherent rate of that would be typically about 50 beats per minute. Can you survive if your AV node is in charge? The answer is yes. However, you do see significant changes in terms of your endurance because, again, it cannot adjust as effectively compared to your SA node. AV bundle, which is the next thing, called also bundle of His, is a branch that comes off of your AV node and runs through the superior part of the interventricular septum. This is allowing the electrical impulse to move from the atria into the ventricles. Now, AV bundle continue branching to the right and left bundle branches, which are basically continue down the interventricular septum and allows, again, the electrical impulse to continue spreading through the ventricles. Now, these bundle branches form really tiny branching called Purkinje fibers. These Purkinje fibers are extremely important in terms of they allow the electrical impulse to rapidly spread through the ventricles, and therefore allowing the ventricles to contract as one unit. Now, from AV bundle all the way to Purkinje fiber, and their inherent rate in terms of electrical impulses is about 30 electrical impulse per minute, which is not sufficient for keeping someone alive because the circulation is not sufficient to bring oxygenated blood and collect it from the systemic circulation. Now, here is the same thing that we described in writing. The initial signaling comes from or electrical impulse comes from the SA node on the superior aspect of the right atrium, pass the signal to the AV node. AV node passes it to the AV bundle, and the AV bundle continue to branch to form branches or bundle branches, and eventually these really tiny branching, which are called the Purkinje fibers. So again, I'm not going to go into details about this, but if you have conditions like heart block, where the connection between SA node and AV nodes are either interrupted or completely stopped, these individuals require a pacemaker to allow to reestablish the patterns of the electrical impulses and allow the person to basically live a healthy life. Now, in terms of heart supply of the oxygenated blood, understand that there is a specific category of blood vessels that's supplying the heart itself. Because they're associated with the heart, they're called coronary arteries. They originate from the aorta, which is logical since aorta is carrying oxygenated blood. And you form two main branches off of your aorta known as left and right coronary arteries. So let's take a look at these on a picture. Again, this is really in detail in terms of slides, but I like to depict it for you guys on a picture because it makes it a little bit easier to follow. So take your, let me just switch to a later point. So here is my aorta. Here is two branches coming off of the aorta. These are my two main coronary arteries. Again, here is my left one, here is my right one. So left coronary artery comes down and form two branches. The one that runs in front of the heart between my ventricles, and this branch is called anterior interventricular artery. And the second branch comes around the heart or goes around the heart. Kind of think about it around the circle, the circumflex of a circle. So this is going around also, so we call that the circumflex artery. Now, in the anterior aspect on the right-hand side, we have the right coronary artery with one main branch that runs on that side, supplying the right ventricle, called the right marginal artery. In the posterior aspect of the heart, you have one main blood vessel that runs in the middle of the heart, in the back. So that is called the posterior interventricular artery. So anterior and posterior interventricular artery. You have circumflex artery, you have right marginal artery, and then the two main branches, which are left and right coronary artery. Notice there are many additional branches on the surface of the heart with no labels, because these branching varies from one person to another, and therefore there are not a specific or they're not generalized in terms of identification. Now, again, this is basically the same idea. Coronary arteries are the main branches that are coming off of your heart or your aorta. Interesting fact, which I think somebody should know, you guys should know, is that heart receives about 1/20 of the blood supply, which is amazing considering its size. So 1/20 is a significant amount of blood supply. And the main reason is that basically it's contracting 24/7, and that contraction in average is about 70 beats per minute, and every contraction requires a lot of energy. Now, I have supplied the oxygenated blood to the tissue. What are the blood vessels that collect the deoxygenated blood from your heart? So these are identified as your coronary veins. The main coronary veins, and again, you have many of them, but the main ones that you have is the cardiac vein. Cardiac vein collects blood from all of your capillary circles. And then you have your coronary sinus, which is collecting from your great cardiac vein, middle cardiac vein, and a small cardiac vein. And then again, you have several anterior cardiac veins that are emptying directly into the right atrium and the anterior surface. And these individually changes from one person to another, so we're not going to look at it in details. But let's look at the main ones here that we have described. So you have the great cardiac vein that runs right in the front. You have middle cardiac vein that runs in the back. You have a small cardiac vein that runs on the surface of the right ventricle. All of these are going to the posterior aspect of the heart and empty into this large blood vessel called the coronary sinus. Coronary sinus is emptying into the right atrium. So if you see the connection, it would be releasing blood into the right atrium. And again, notice that you have a smaller branches of the anterior cardiac veins, and these are more individualized rather than the general pattern we see for the four mains that we discussed here. Now, looking at some of the imbalances, homeostatic imbalances in terms of your heart, you have what we call angina pectoris. This is what identified as the pain that is located within the chest cavity or localized within the chest cavity because part of the myocardium is not receiving enough supply of oxygen. Typically, when your cells are not receiving oxygen because your coronary arteries are blocked, that causes the cells to weaken, and as a result, again, represent that weakness in terms of chest pain. Myocardial infarction or heart attack is when part of your heart is not receiving oxygenated blood for either a short period of time or long period of time, depending on the level. Basically, it's lack of blood supply to part of your heart. And because these coronary arteries are blocked, Lack of oxygenated blood causes the coronary tissue to die, and that's basically what we identify as heart attack. Now, here's the question. Can somebody fully recover from a heart attack in terms of their myocardium and pumping action? And the answer is no. And the main reason for that is that when cardiac cells die, it gets replaced. If the person survives the heart attack, it does get replaced with healthy cell or repair tissue. However, the repair tissues are non-contractile scar tissue. So basically, they can never create the same contractile force. Your heart can never create the same contractile force because it doesn't have the same number of cells that it started before the heart attack. Now, I want to spend a couple of minutes and finish one topic, which I think is something that you guys do need to know, going back to the electrical impulses, and that is the pattern you observe on an ECG. And again, this is a really simplified version of this component. You'll go into a lot more detail when we talk about the physiology of the cardiac cycle. But a typical ECG, which stands for electrocardiogram or electrocardiograph, if you talk about the picture, has three parts. It has a small p, which is identified as a P wave. It has what we identify as a large complex called the QRS, and then another wave, which is called the T wave. So what are these structures correspond to? P wave is associated with atria are about to contract. So this is an electrical impulse, the initial electrical impulse passing through the atria, which leads to contraction of the atria. This is representation of the electrical impulse that is spread through your myocardium of the ventricles. So notice it's much larger than the atria because ventricles are larger and they have a more advanced network of non-contractile cells to create electrical impulses. And the last wave you have is called the T wave, associated with ventricles are about to relax. So understand that anytime you create electrical impulses, like in the first two waves, you need to basically return things back to normal in terms of charges. This is the actual process called repolarization, which you learn about a lot more in, again, physiology. But this wave represents the ventricles are about to relax after their contraction. So if you look at somebody's ECG, either looking at the more simple version, that's 4 electrodes, or a more advanced version you typically see in hospital, which is a 12 lead electrode ECG. Regardless, they give you a picture about your heart health, and they can be establishing how the electrical impulses are spreading through the heart that leads to muscle contraction. Okay, so we're gonna stop here. And again, if you guys do have any questions, you're welcome to discuss them with me during office hours.